Let's talk about these changes to Dorset's NHS, shall we? The organisation which oversees NHS provision in Dorset, the Clinical Commissioning Group, says it's very pleased that changes to the health service in the county have been given the go-ahead by the Secretary of State for Health. Campaigners, though, who have long fought these changes, say they won't give up. We'll talk to one of those campaigners in a mo, but first, here's our reporter Michelle Cross with an explainer of what exactly is planned.
The plan is for Poole's A&E maternity and paediatric services to go to Bournemouth, and Poole will become a centre for planned treatment and operations. A new women's and children's unit will also be built in East Dorset. The Clinical Commissioning Group says there will be a £147 million investment in acute hospital services at Bournemouth and at Poole. In Poole, it means a new urgent treatment centre and 14 more theatres. The plans were first put forward in 2015, so why has it taken so long to get to this point? Well, the plans have gone through public consultation, independent scrutiny and various legal proceedings. There's a lot of opposition, not least from people who say that travel times to Bournemouth would put patients at risk. The CCG denies this is the case. One campaigner from Defend Dorset NHS has told us that they will lobby hard for a new local trauma centre for Poole, and they haven't given up the fight.
Well, talking about Defend Dorset NHS, Debbie Monkhouse has been campaigning against these changes with that group since 2015 and joins me on the line now. Debbie, good morning.
Good morning, Steve.
Your reaction to this decision then?
Well, obviously it's appalling. Boris Johnson claims we'll have 40 new hospitals, so why are these life-saving departments being closed at Poole? It makes no sense at all. It may have been a public consultation. 36,910 people signed petitions opposing the changes, so the public didn't want it. And the Court of Appeal accepted in July that longer journeys would mean deaths, and they accepted that in the worst scenario, based on the Ambulance Trust report, this could be up to 400 ambulance patient deaths each year, and that figure doesn't include the risk to patients who in an emergency don't go by ambulance, which is the majority of maternity and child emergencies don't go by ambulance. Yeah. There's no clinical evidence base for the plans. The clinical evidence that they rely on was undertaken in London and Manchester, where the maximum time to the services would be 30 minutes. I mean, it's 40 minutes by blue light from where I live in Swanage to Poole now, and that's once the ambulance has come. There isn't any evidence base for these plans in rural areas. And in fact, in Shropshire, where they've reconfigured the stroke services, so you have to travel further to get to allegedly better services, less than 20% of the people who'd benefit from treatment on arrival arrive within the time frame to enable them to have the treatment that they need. So the evidence is overwhelming that it's not rocket science. That's why we have blue lights, that time really matters when people are critically unwell, and minutes can be a matter of life and death.
These are arguments that we've heard from you and from campaigners over the last 4 or 5 years. What do you think now, though, that this has been effectively rubber stamped by the Secretary of State for Health? It looks like this is all going to go ahead.
Well, can I just quickly say something about capacity? Bournemouth Hospital will have to be the A&E and maternity hospital for the whole of the conurbation catchment area. And by locating trauma, because it's to the east of Bournemouth, it will also attract people from West Hampshire who currently don't access Dorset for emergency care.
And there's going to be 140 some odd £million invested, mainly in infrastructure to enable that kind of stuff to happen.
Well, we're talking about 750,000 people will need to be accessing RBH, A&E and maternity. A similar giant A&E in Portsmouth, which does 625,000 people, so less, has been in special measures. It's routinely patients are waiting 12 plus hours to be seen. Staff have described it as like a war zone where they feel de-skilled. The 147 million doesn't even cover the costs of moving services to Bournemouth out of safe reach from most of Dorset. That cost had risen to 170 million by March of last year, according to the CCG statement to the court. So I don't know where the rest of the money is coming from for that. And the revenue budget is running at a deficit. So there isn't money for services closer to home. And in fact, as we all know, mental health services and social services in the community have been run down. It takes longer to get a GP appointment. So actually more people are driven to go to A&E. What we're hoping for now, Steve, is we're not really hoping. The independent panel in their advice have referred again to the possibility of A&E local. And what A&E local is a fully functioning A&E at Poole that would not be open 24 hours a day, but say would be open 16 hours a day and not overnight. However, the CCG have declined to refer to this at all in their press release. So we're wondering what's happening about that. That was a suggestion made by the Health Minister when he asked the independent panel to look at the plans. And it's in the independent panel's advice at the end that is something that needs to be considered.
Right.
So it's not as good as a 24-hour A&E at Poole, but clearly it's a lot better than no A&E at Poole. And I don't know what the implications of that would be for emergency maternity care. I would assume that if there was a fully functioning A&E open 16 hours, that emergency maternity care would be available during that time.
Yeah.
Because if someone under 32 weeks in Dorset goes into labour, they will now have to get to Bournemouth Hospital. That will be the only location that can deal with a birth under 32 weeks.
Debbie,
if they live on Portland, they'll have to get there.
What do you? How do you think we will look back on a day like this? I mean, you're talking about significant changes. The CCG say it will be a change for the better. You're saying we'll wait and see. It's almost certainly going to be a change for the worse. I mean, is this a significant point?
It certainly is. I think we'll look back with great shame and horror at these decisions to basically decimate Dorset healthcare services. We're going down from 3 A&E and maternity units to 2, and we're losing community hospitals and or beds in 6 of 13 Dorset locations, and we're losing 245 acute hospital beds. I mean, RBH A&E can't cope now. You know, they missed their waiting times target 20% of the time in December. The idea that they're going to be able to cope is ridiculous. And RBH is built on a floodplain. You know, we've got climate change emergencies being declared by BCP Council and by a range of local and parish councils. We know that water levels are going to be rising. This is absolute madness, locating these services out of reach for the majority of Dorset on a floodplain.
Debbie, really good to talk to you this morning. Debbie Monkhouse, one of the members of Defend Dorset NHS there. It's 8:15. That's one of our top stories today. Campaigners vowing to continue lobbying, so they haven't given up the fight over plans to move A&E from Poole to Bournemouth Hospital.